Guys, any pictures or any videos, hashtag at all times GITEX Future Stars. You got 8 minutes starting now.
All right, welcome everyone. Donor is a platform to help aimed at helping with the provenance management of medicines, of vaccines, of organs donated, as well as blood. So we actually apply IoT and NFC technology, and we could demo the product for you currently. And we've identified certain problems around the world related to organ donation, related to blood being traded in many parts of the world. And it's a big problem. In certain countries, it reaches up to 30% of the blood used is actually blood that is bought, not blood that is donated. We've identified that there's also a lot of death happening, but there's no instant verification of the person who passed away, and therefore how to make use, harvest their organs. And we found a way how to employ all these technologies to solve these problems, and we're going to show you how. So in the case of blood, when we look also at the forecast, the problem today is already acute, 30% in certain countries. But when we look at the future, we actually figure out that this problem is going to aggravate even more. So the number of donations that is happening is way less than the requirements today. The other problem with the organ donation is the provenance. How can we verify beyond the doubt when a hospital receives an organ that this is the same organ that came from a certain hospital? And to do that, what we've done is we've created a blockchain platform whereby every single hospital, by law, wherever it's applied, by law, has to actually take a swab, DNA swab, send it to a lab where they will upload that DNA signature onto our blockchain platform. Then each hospital that receives that organ, they also have to take a swab, send it to another lab who will upload it onto our platform. The platform will say matching or not matching. And that helps us solve a big problem. Until today, you hear about people jumping the organ wait list. You hear about abuse of children, women, or literally slavery because of organs. So we're hoping to address that. Also, all around the planet today with the global warming, you're hearing about the problems of certain catastrophes that are hitting certain countries. And then how can you realize at one instant how much medicine do you have around the country, and how quickly can you bring it to the affected area? What we do is we have tags for every single medical product. If we get the approval of the government or the Ministry of Health, whereby it will enable the ministry to have an overview of every single pack where it is available and quickly order to the area that requires rescue support. Finally, we help the government to make sure that if there's any problem related to the provenance of the medicine. So is this medicine tampered with? Is it counterfeit or original? Has it been actually managed throughout the logistics, so the supply chain? Was it managed effectively, or was it actually damaged and the active ingredients are no longer effective? So what we can demonstrate for you is our solution in order to track the history of the medicine. And how do we train every single user in a certain country, every single patient, if they are getting a certain medicine from a pharmacy or a doctor, or a vaccine from a doctor or from a hospital, they would tap the product, get all the information, the history, in order to verify that this product is original, it was not tampered with, and that it was maintained through the supply chain at the right conditions. Finally, we have a marketplace where we would actually sell a number of life-improving solutions to the patients themselves, where they get also educated, notified on the different kinds of conditions that they would get. This is today available. The application is available for download under donor.org. You can look it up on both stores. The most important thing is we apply blockchain just to maintain the GDPR compliance. So at any point of time, the patient's data are not available with us. They are maintained with the local Emirates ID, for example, and the local medical record authority. We wouldn't be retaining any data. They would only be pinging the data, but we don't retain any personal information. The team, currently we're 12 strong actually, and this is the management team. We are supported by a number of advisors around the globe, from Houston, Texas with Cypress Clinic to Robert Jenkins, who's an expert in the logistics or the supply chain for the controlled substances, to Dr. Javier, who's helping us with the machine learning, part of Polytechnic University of Catalonia, Barcelona. Our ambition is big. This is our first product. Today we're waiting, for one government to give us the green light for us to implement it, be it across the GCC countries or anywhere around the world. The moment we get that first traction, then it's just a matter of time for all the countries to want to, have the same kind of treatment for their patients. Thank you for your time, and I look forward to your questions.
Okay, thank you. Give him a big round of applause, ladies and gentlemen. Thank you, sir. Judges, you have any questions?
That's an impressive presentation. Thank you. So, am I correct to understand that your business is contingent, the success of it is contingent to getting government approval?
Absolutely.
Without which you basically cannot operate?
Absolutely. And there are two ways to get that.
Okay.
So there's a push or a pull. The push, we're doing it today, so we are in contact with all the health authorities. They've all expressed interest around the region, and so we're doing as much as we can our push. The pull is literally to get more individuals to request from the government that we require a healthcare system that is watertight. Very simple. And that you get it from media, from lobby, from...
And is this such that there can only be one agency or blockchain provider that tags all the identity of the blood? Or there could be multiple players within, say, each country or jurisdiction?
Yeah, typically the standard is set by the country. So if a country signs with us for us to build for them the blockchain that they would have their own data and they would maintain their data, then that's it. That's one protocol. But then the tags would be bought by any company, can be provided by other companies. We make our margin on two things. One is building the platform for the government,
yeah, and
the other one is supplying the distributors or the manufacturers with the tags. And I can show you just a quick sample for how small it is and how minute it is and how it would be implemented. So these are the tags, and later we could demonstrate at our stand how it works. So when you tap it, how do you get the message, the history, where was it done? Oh, I'm sorry. So where was it? What is the history? What is the provenance? Was it maintained in terms of logistics conditions and so on and so forth?
And how integral is the blood bank, hospitals behind this particular project? Do they have to be all on board simultaneously for it to be because the way I see it, you kind of have pockets of participants. You seem to have almost the entire ecosystem participating for it to be effective.
Well, all we require is the green light from the top. The moment we get the green light to implement a national protocol for all the medication, vaccine, blood bags, organs to be verified on that protocol, we're done. We're sorted.
Hey, Wasim.
Hi.
So, in terms of your policy, you're here to make money, right?
Correct.
It's a business. The intention is to make money. I understand that the idea is good, right? It's the future. This is where we are working towards. But when it comes to saving lives,
Yes.
or when lives are at stake, what is the policy that you are going to adopt? Are you going to monetize that, or are you, or is there any pro bono?
Thank you for the question. All right. So everything that we are offering to the end user is free of charge. Any user that goes in, any patient that goes into a pharmacy, wants to verify the medicine, the vaccine that is given to his kids, the organ that his families are going to receive, all of that is done free of charge to the users. Who we charge? We charge the authorities for establishing that platform, and then we charge per tag, the tags that you've just seen. This is to either the manufacturer once the standard has been set, or we charge it to the distributor if we agree to that.
Okay, so if a government actually adopts the system that you are promoting, they're going to make it mandatory, as you say,
Correct.
for the for the market to adopt it as well. But then you're going to sell it to them, right? So basically, your government is going to help you make money. That's what you said. That's what your idea is. Right?
Yeah. So today, it is more and more a requirement every day. When you hear about 100,000 people dying from counterfeit medicine, it's a requirement anyway. So it's which government will actually promote that they are more transparent when it comes to healthcare. Which one is really serious about healthcare tourism? Which one?
Yeah, but it gets very political when you are actually when the government is actually trying to make something mandatory for the
Sure.
pharmacies, for example. They have to go back to you and buy. You get the point for the whole okay. I don't say it's not possible. What I'm saying is that it might take a lot of time, and the time that this whole process takes because your whole business is based on this, right? So if it takes a lot of time, aren't you afraid that there might be competitors popping up?
Well, all right, I cannot say a lot. So all the discussions that we're having are actually confidential. So I cannot talk about it, but just come to Arab Health and come in and you'll be surprised.
Okay.
That's all I can say, which is January 29. Yeah, that's
so
our
thank
date.
Mr. Kareem?
Yeah, thank you. I think the initiative is great. I'm an optimistic pessimist, right?
Yeah.
And I think that you guys have this top-down approach. I think there's a lot of factors that could really prohibit this from launching, right? You have the government, you have legislative considerations, right? There's a lot there. So that said, do you have any idea of what the sales cycle looks like? Have you estimated what your sales cycle is going to look like to be able to get this through?
Yeah, globally, the total addressable market for verification of all pharma and biomedical product is estimated at 180 billion by 2019. This is public information available. So many countries around the world are applying exactly the same standard. And guess what? Everything that you just mentioned has actually been addressed in the US, in Canada, in Europe. So all of the regulatory parts and the privacy part has already been addressed. The only thing is here we're a little bit late, and our solution simply gives a little bit more. So we're looking at also the DNA verification, and we're looking at the NFC and the IoT, how to integrate all of that on a blockchain that the governments can adopt and implement across this region. Very simple.
Fair enough. And my last question is about blockchain. So if a government is going to be managing all of this data, like what's the value of blockchain? I mean, it's all sitting on multiple servers for the government. What's the value there?
A number of things. So A is actually how do you provide certain individual privacy, so channels, what we call on blockchain channels, which is private channels for each and every provider for them to have their own data. That you cannot create one ERP and everyone's connected. They would see each other's information. So this is what we are applying is Hyperledger Fabric 1.2, which allows for this private channels for each of the providers. One. Second, it is a fully integrated ERP across all of the platforms, and we have 1,000 nodes that we are offering to any government. If they want us, so we break down the data into pieces, and it gets spread across 1,000 nodes without even looking at the local infrastructure. If they want every pharmacy to be part of it or every hospital, then we add those as well, nodes. Or if they want it only within the country, then we can actually restrict it to the number of nodes available within the country. So the flexibility is not possible outside blockchain.
Got it. Thank you so much.
All right, thank you. One more round of applause for Donor, please.